Welcome to the Rehab Roundup. I'm your host, Dr. Hassan, board certified physiatrist and independent practice owner, helping physiatrists in their first 5 years out of residency build profitable businesses so that they can achieve financial independence. Hello, Dr. Erica. Thank you for joining. Thank you for those who are tuning again this week. And I'd like to say welcome to those of you who are joining for the first time. Last week we talked about physiatrists as the post-acute specialist. This week I want to talk about what is your rehab diagnosis. So under the guidelines of participation per CMS or Medicare, 60% of the patients in your rehab unit or hospital have to fall within 13 diagnostic categories, or what we like to call CMS 13. So those are neurological disorders such as Parkinson's disease, multiple sclerosis, transverse myelitis. You can have traumatic brain injuries, non-traumatic brain injuries, traumatic spinal cord injuries, non-traumatic spinal cord injuries. You can also have hip fractures and couple other diagnoses as well. But that's kind of the bread and butter categories or rehab diagnoses that per CMS guidelines, 60% of your patients have to fall within those diagnostic categories. Now also you have to have patients who can tolerate the 3 hours of therapy. They have to have a need for at least 2 disciplines of therapy, be that physical therapy and occupational therapy, speech therapy and physical therapy, or speech therapy and occupational therapy. Hello, Dr. Dia. Thank you for joining. So again, CMS 13, 60% of the patients within your acute rehab unit or hospital have to fall within these diagnostic categories. Now that's important because what you can do is kind of focus your marketing or what have you to the particular specialties that really manage those particular patient populations. So if you're talking about neuro-based populations, you want to talk to your neurologist, your neurosurgeons. If you want to talk about traumatic injuries, you want to talk to your trauma team if you consult at a level 1 trauma center. And if we're talking about hip fractures or orthopedic injuries, you want to focus on your ortho trauma teams. Again, this is Dr. Hassan. Thank you for joining me for the Rehab Roundup. Look forward to talking to you guys next week. Again, I am Dr. Hassan, board certified physiatrist and independent practice owner, helping physiatrists in their first 5 years out of residency build profitable businesses so that they can achieve financial independence. You can follow me on Facebook at Dr. Hassan Rehab, DrHassannRehab. Thank you and see you next week.